It's
Name that road.
Leesburg Road. It's where the FEMA.
We'll get paid back.
Oh, yeah, okay. I actually know the answer.
Kelly, FEMA grant.
All right.
Sliding behind me, FEMA. David's not coming to get that piece of mail back.
Remember the house that kept getting flooded?
We were waiting on stuff that ultimately didn't happen.
We were trying to transfer the land and water grant from the cemetery out there, but they wouldn't let us do that. Isn't that right? That's what it was, wasn't it? That time of day.
Michelle. That's why that clock's wrong.
Good evening. I want to welcome everybody to our Scott County Fiscal Court business meeting tonight on Thursday, the 23rd day of February and the 23rd, 2023. So I'd like to ask everyone to join me in the Pledge of Allegiance. Let us pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Ms. Hamilton, would you call the roll?
Mr. Hostetler?
Present.
Mr. Jones?
Here.
Mr. Wallace?
Here.
Mr. Corman?
Present.
Mr. Ellison? Mr. Pratt?
Here.
Mr. Livingston? Mr. Culbertson?
Here.
Judge Covington?
Present. Thank you, Ms. Hamilton. First item on our agenda to address are the minutes from our previous meeting. Are there any questions or comments related to those as presented? Motion from Mr. Corman, a second from Mr. Jones. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Number 5, transfers as presented in your packet. Any questions or comments? Michelle, will you step to the podium and be able to clarify?
Yeah, there's one line item for $270,000 legal services.
That covers the Leesburg Pike closing cost as well as the easement cost for the McIntosh property, I believe.
No, not the McIntosh. It's the FEMA reimbursement on the Leesburg Pike. That was that.
Then there's a $20,000 for the McIntosh as well.
Okay, so
Isn't
that was
total?
that was lumped in there.
Mm-hmm.
So the McIntosh portion of that is on US 460, and that's the Joshua Court drainage easement, the permanent drainage easement payment for that portion of that Joshua Court project.
Was one of those properties that we were going to try to transfer that cemetery easement?
Yes.
But it didn't.
It didn't work.
But it didn't work.
It
Okay.
was
Didn't
not. It wasn't something we could navigate.
That's why it's been so long since we've talked about it last time. They were
trying to
see if
navigate
would work
that.
out. Yeah,
Yeah.
it didn't work out.
Yeah. So we need to keep that
Yeah.
We're still
on our minds.
Yes, that's it's a issue that's not going to go away. We've got to find a solution to it.
I think there was one other big ticket.
We did transfer, budgetary transfer from the sheriff's office motor vehicle line
Almost.
item. We reallocated that because those items are now lease. So we moved that to a lease purchase, the principal and lease purchase for the interest to accommodate the auditor's request.
Gotcha. Thank you.
Mm-hmm.
Any other questions or comments related to those? Motion from Mr. Hostler, second from Mr. Wallace. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Bills and hand checks as presented. Any questions or comments?
Just bills, no hand.
Okay, no hand checks. Sorry. Bills as presented. Motion from Mr. Hostetler. Second from Mr. Jones. Any other questions or comments? All those in favor, please say aye. Aye. Any opposed? Motion passes. Let the record reflect that Mr. Chad Wallace and Ms. Rebecca Johnson completed their training units of continuing education. Also, let the record reflect that the county clerk's office submitted fees in the amounts of $127,959.31. The sheriff's office submitted fees in the amount of $29,780.44. Supplemental fees submitted in the amount of $141,367.96.
And the record just needs to reflect they were submitted on the 10th. That's
Okay.
their deadline.
All right. So let the record reflect that they were submitted on 2/10. Any questions? That does not require a vote. Number 10, EMS presentation. We've got several guests here today, and we appreciate your all's attendance. And Chris is going to present some information about proposed paramedicine program. And I was able to attend a meeting at the hospital, I guess last week, and the prospects of this paramedicine program is very exciting to me. It's very proactive, but there's other avenues that it could expand into once it gets started and gets its feet wet. So I'm going to turn it over to you, Chris, and thank you and your team, and appreciate everybody being here.
Excuse me. Yeah, thanks, Judge and Magistrates. Good evening. I'm the one doing the presentation, but certainly not the one that has done the lion's share of the work on this project. Corey Wood, Uriah Tyndall, and Matt Martin are part of EMS. They put large chunks of time and effort into this, as well as Officer Lodell and his team that are here. And Tracy Evans is the director of the emergency room at Georgetown Community Hospital. So we're going to be partnering with those folks if we move forward with this. And so I'd ask them to come today in case you had any questions. Short slide presentation. I think there's 5 or 6 slides up here. I felt like the best way to do it was just kind of introduce it to you and then let you all ask questions about what you had about the project. So if you could go ahead to the next slide. So just basically, what is community paramedicine? So we're looking to bridge a gap that's kind of a void that exists in healthcare now, where instead of traditional 911 calls, where somebody's calling and we're going out in an emergency situation, this would be a community paramedic that would be in an SUV that would respond to scheduled calls and go out and do house visits, kind of like they used to do with house calls. So if you think that last paragraph there, that little blurb at the bottom, if you think as a paramedic, traditional paramedic is an extension of an emergency room physician, the community paramedic is an extension of the primary care physician. So we're treating and seeing things that you would go to your primary care doctor for. So there's a couple of, well, I'll say a couple. There's about 50 or 60 different paths you can go. I mean, this could really explode on us, and it can be overwhelming. So I've listed the 2 paths that we plan to focus on initially, and that's community paramedicine and mobile integrated healthcare. So the community paramedicine, again, that would be where we partner with folks like our law enforcement friends for a substance abuse population, and we go out and do home safety checks, make sure folks are being compliant with their medicine, counting pills, things listed there, making sure they have transportation to and from doctor's appointments. And then the mobile integrated healthcare is where we'll be partnering with the hospital. Initially, we're going to focus on a very specific population of patients, and that is heart failure patients that have been discharged from Georgetown Community Hospital. They have to have a follow-up within how many days? 14 days. So rather than them having to go to a doctor's office to make that visit, we will drive to their home and do an in-home visit. We'll either have a mid-level care provider with us, like a nurse practitioner or a physician's assistant that will accompany us, or we'll have a tablet and they can do telehealth. But again, we'll be conducting those discharges. And that helps the hospital on their end maintain their accreditation, the things that the Joint Commission looks at when they come in and inspect the hospital. But a lot of these folks are just not getting the care they need because they're not following up after they're discharged. Where we go from that initial these initial 2 paths is hard to say. We're going to kind of let the data drive this project and see where it goes. But we'll be doing things on those visits like 12 lead EKGs, drawing blood to take back to the lab to get those tests run to make sure that they're doing what they need to do on their end. You can skip ahead to the next slide. So kind of what would it take here to get this project started? And a community paramedic. So that is not an officially recognized certification by the state of Kentucky yet. The state says that's probably going to be about 6 months down the road before the process is formalized. But they said if we go ahead and get certified and get our program approved by the state, we would be grandfathered in, wouldn't have to go through that process. So that is our intent, is to do that. We'd need a vehicle, obviously, to make the visits in, and then approval from the Kentucky Board of EMS. And we have those things listed under that. The things with the check marks are things that are completed, And so we're about 80% through that process now. We'll submit that application, and we can ask for an expedited review. We anticipate 30 days, maybe up to 60 days from the time we submit that application to hear back of whether our pilot project has been approved. There have been similar projects around the state. Lexington has a big one. Their focus is more on their homeless population. So they focus on social work and that kind of stuff more so than the mobile integrated health. We're initially going to try to go 2 ways with ours and see how that works for us. Where do we start? Keep up with my slides. It'll be a good start. So we're going to partner with the hospital to conduct these follow-ups on the heart failure discharges, visit the patients in their home, and then we're going to partner with PD to address the substance abuse population. Corey Cancel is here from the Victim Advocates Division of PD, and I'm going to ask him if he would just to brief you guys a little bit on what a recovery-ready community is or what that entails. Step on up, Corey.
Corey, thanks for being with us.
Oh, thanks for having me. So recovery-ready communities is something the governor just put out about a month ago to address the substance use disorder problem all over the state, across the country, and here in Scott County. So I'm kind of going through each of the certification, the scorecard to see where we stand now and what we need to be able to be one of the first few counties to do that. And, you know, our partnership with EMS is just critical because, you know, at the police department, they can find out any overdose calls that they made, but EMS is going to have the majority of them. So partnering with them and getting that information, we do a overdose response team where we go out 24 to 48 hours after an overdose, give them resources. We have the health department with us to give Narcan, and we just try to connect with them to try to get them into treatment when they're ready. No judgment. So the recovery-ready communities, you know, this paramedicine plan would definitely get some points to get us to where the recovery-ready communities is. So it's super important to kind of get out and be more proactive instead of reactive.
Anybody have any questions for Corey?
Yeah, so this is an initiative that the governor has, I guess, sit down throughout the state. Is there going to be any money or funding that's going to be associated with that?
One of the thought processes that I shared at our meeting at the hospital is, could our opioid settlement money funds be used for the portion that is focusing on addressing the recovery portion of this program? So that's something that we want to look at and support there. And then the other question I had, from my knowledge, there's no funding straight from the governor's office for recovery-ready communities.
No.
I don't think. But the other thing I wanted to ask, because we know that there are individuals that are experiencing the same type of issues in the county, and could the sheriff's office, partner on, making these type of calls out into the county as well? Coupled with a paramedic and maybe a sheriff's deputy and going out into the county. Would that be something
So
we could partner
currently, with the Georgetown Police Department, we're actually taking countywide, so he gives us countywide information.
Okay.
So we don't limit it to just the
I
city.
just
We go to the county.
Wasn't 100% clear.
Yeah, we currently do that.
Okay, that's fantastic.
But one question on I didn't bring my template with me, but one question, for instance, was having a Narcan leave-behind program. Once this gets going, get their feet wet, hopefully that's something we could expand to, because that's 4 points out of 75 that's needed in that category. So anything we can do to be proactive instead of reactive is definitely
Any other questions?
So with this community-based paramedicine, maybe I just don't understand the connection between this and recovery ready. Like, how are you all going to go out and affect the substance abusers in the community?
So currently, what we do now is anytime we have an overdose case, we provide information to victim advocates and then they go out and visit these folks, provide them information, what support resources are available to them. So having us to go out kind of jointly together, and law enforcement will be a big part of this because that's our link to social work. So it's more, the community paramedic is more of a liaison to whatever services the patients needs. And then, you know, a portion of our population kind of slips through the cracks and doesn't have access to health care. So we've looked at a couple of big community paramedicine programs around the country and how they operate and how they sustain their program. And one of the options is a membership where folks could pay $100 a year. They would get a monthly visit. We'd come by and do all the things on the slide and check them, make sure that they have all the resources they need. We'd move into the nursing homes with that as well. So, you know, again, we're trying to start with a very focused intent because it's so broad of what you can do through this program. But we would partner for the substance abuse folks, we'd partner with PD. Yeah, and we kind of do that now. We just don't go out together. We provide that information and they make that visit.
So you stated that you needed a vehicle to start. Would that be the ambulance itself, or
it would just be an SUV? Typically, they're unmarked because you don't want everybody in the neighborhood. You know how your neighbors are when the ambulance pulls up in the driveway. So an unmarked or very kind of low-key marked vehicle. Most of these appointments are going to be scheduled. So we envision that we'd have somebody from 8 to 5, Monday through Friday. And to make those appointments, they get the referrals from the hospital about what discharges they have for the week or the month. And we call those folks and schedule the appointments. Same thing with PD. I think you guys still meet on Tuesday morning. And, you know, we would be a part of that meeting and make those scheduled visits with them to provide whatever resources.
Could you go back to the slide that talks about really you have two avenues, that mobile integrated healthcare. What that's doing is taking pressure off the emergency room, taking pressure off 911 calls, hopefully, and trying to be proactive. That's the
right, and
that's the low-hanging fruit, right?
Yeah, and we, you know, kind of jokingly refer to folks that use our services as frequent flyers. The PC term for that is high utilizers. So we would be scheduling appointments with those folks in an effort to head off that 911 call. So we're going out, we're scheduling, they know when we're coming, to check on them, to see what they need, to get them any resources. So hopefully then they're not showing up at the emergency department or calling 911. So it would cut down on call volume and stress of the resources currently.
Rick?
Well, on that side of the program, are you able to recover any kind of, like, maybe insurance? Are you going to bill insurance or?
Yes, so there are some insurances that participate now that will pay $100 a visit. And we, again, are just scratching the surface on this, but we talked to the folks in Lexington and talked about their program, and they will, the insurance company will provide you a list of all the residents in the county that are subscribers of that insurance, and if you make the visit, then they'll pay you $100 for that visit. We don't know how many insurance carriers do that right now, but we will by the time we are ready to start.
And the discussion was, you know, reaching out to Anthem, reaching out to...
Oh, yeah, we'll reach out to all of them.
Yeah.
What about the mid-level? So are the mid-level providers, are they employees of the county, or are we hiring somebody, are they going to get reimbursed?
So the mid-level provider will be an employee of the hospital, and they have agreed to provide that provider for us. So that's no cost to us. We don't incur any of that. The hospital will bill for a follow-up visit. Some of those visits are required to be in person, so that's when we'd go by the ER or the hospital and pick up the provider, take them out to the house with us. But for follow-ups that they could do telehealth, we would need to do that.
Rob?
Would the personnel used to do these follow-ups, is that during their regular schedule, or is that going to be like
Yes,
come
so
in
that would
special
be,
times? And
yeah, well, it would
work
be a
overtime?
separate individual that we would have to hire that position for,
Okay.
and it'd be a Monday through Friday, you know, 8:30 to 4:30 kind of thing. No coverage on weekends, and that's typically how these programs are set up across the country because most of your appointments are set up in advance. We would have the exception in there for if our crews or even law enforcement, anybody responded to a home and say, hey, there's a need here, these folks need APS or CPS or something, they could call us, we would go out and do an assessment and then loop in the necessary.
So do you anticipate having trouble hiring somebody for that position?
No, I don't think, I mean, you know, paramedics are hard to find right now, right? So we have just got our education folks certified to teach the community paramedicine. So we are going to put through this first course 4 or 5 of our folks in-house But then we'd post and see if we could get somebody from the outside to apply as well. There's an advantage to being Monday through Friday, 8 days a week, and not on a 24/48 schedule running 30 calls a shift. So I think that might be a little enticing for somebody to.
So what type of metrics could we use to judge the program by to see if we're making the impact if we approve this? And
Right. And that's a big part of it, right? So you see on the one that had the K-beams list, the data collecting and the quantitative reporting process is what the state wants. Our partner with the hospital is going to be able to help us there because they are judged on those rates and say they're at 40% on their follow-ups for heart failure discharges. Only 40% of the patients are getting follow-ups. So that's a hit to them financially. They don't, and Tracy could probably speak a lot more intelligibly about this than I could, but it helps the hospital by being able to up that percent to say 70 or 80%. So that's their buy-in for that. The metrics we would use, we already tracked, the narcotic stuff I send you, overdose stuff I send you monthly. So we do some of that reporting already, and then our software already has built into it reporting for this community paramedicine. So we're going to have to crunch a lot of numbers to see. And so that was another thing we talked about, Judge, was maybe starting a initial pilot project of 2 years or a year, whatever we decided upon to say, hey, we've been doing it this long. Are we making a difference? Is it worth trying to continue it on, or, it's not. So.
how long will it take to find out if your application is approved?
The only reason I hesitate is because the transition from K-beams, they've come out from under KCTC and now they're their own government entity, and there was a lot of things lost in translation. So their website went down, their emails went down, all this changes, probably is where, has caused quite a bit of delay, and they're understaffed. They've got about 4 or 5 people doing the job of 14 people. So that would be the only holdup. But I think because we know who's going to be reviewing this, and we know who's on that board, we could find out within a month. I think 30 days would be plenty of time to find out. And there's paperwork we're going to fill out for an expedited review. So.
What about people that aren't covered by the $100? Would they get a bill from Georgetown, Stacking EMS, and the hospital?
We would not bill for our services at all through this community paramedicine program unless somebody wanted to join the membership and pay the $100 a year.
And that's something that maybe come down the road, the membership aspect.
Yeah, yeah. Not initially, we're not even.
Yeah.
So the anticipation is you would hire 1 employee and 1 vehicle. Mm-hmm. Do you see that growing?
Yeah, I think quickly, and just as we've talked about it for the past few weeks, it gets overwhelming, Rick, honestly, because there's such a need out there of people that are falling through the cracks and don't have access to the resources for whatever reason. Sometimes that's intentional, But by us going out to them, I think that the doors are just going to open up and we're going to be overwhelmed quickly. So I would think it would grow. Yeah.
But one of the kind of paybacks would be that if you got this program established, you could potentially cut down on the 911 calls.
Absolutely. That's a big part of it.
That's what you said in the beginning.
How many runs did we make last year?
Just shy of 9,000, which was up. Right, the last 2 years, we've jumped up about 1,500 per year, and I don't think that's going to slow down.
And the other thing is that in the emergency room, that time is hopefully decreased for Georgetown Community Hospital.
Absolutely.
The problem is it's going to be very difficult to measure the success or the failure of this program. I'm not wishing ill will, but it's going to be very difficult to say, hey, now they're using this versus making 911 calls, and if the numbers go up, has the program not worked? And so I think that's going to be our difficulty.
I think our 911 calls will continue to go up.
Yeah, that's what I'm saying.
But you'll track how many of these you do, and
absolutely. And the high utilizers is where we'll be able to look and see a stark difference, right? If we have somebody, we had one individual that called us 61 times in an 8-month period last year. 911 calls where we had to respond emergent. So if we do this for 2 or 3 months and say, hey, we haven't heard from this individual in a while, then we can see. But some of them, you're right, Chad, will be difficult.
Are you worried about staffing? Like, I know you touched on it, but these things are all over. We do. Our company does a bunch of them. But staffing, it's hard enough now to staff ambulances.
Right.
And now you're taking at least 1 paramedic, maybe more, off now a truck. So that's more staffing. So
Right, yeah, so again, initially, and as we get into it more, we'll develop a more concrete plan, but initially, our plan is for the admin team to go through this training and to be that initial community paramedic, and then when, if we decide to move forward in July and put this in the budget, then that we will post a job for an individual, yeah.
But Chris, though, our essential, as for the county, our essential duty is to provide EMS. And I think that's probably where we need to keep, this is a great idea, but that needs to be our focus.
Oh, absolutely.
And then this is kind of a secondary program.
Yeah.
Because I don't want, I'm like Ryan, I don't want EMS suffering because
Oh, no,
we can't get paramedics. Because
Right,
they're
we
doing
wouldn't-
these
we
jobs.
wouldn't
And look,
take
if
it-
I was a paramedic, I think I'd want to do the 8 to 4, Monday through Friday job.
Yeah, we wouldn't take somebody off the street for this by any
Yeah.
means.
We're not going to take anybody out of a buggy.
No, absolutely.
I do think, I would like to have more conversations with the hospital, see if there's some chance for more reimbursement from this. Because, right, I mean, for the hospital, it's pay for performance, so we are helping them meet their pay
Absolutely.
for performance metrics, which means they now make more money, but we're providing the services for them to meet
So
all the metrics and pay for performance.
Magistrate Pratt, I would be willing to reach out to the CEO and have a conversation if there's an opportunity for some type of capital consideration.
Yeah, and we have mentioned that, but we haven't gotten a response, so I didn't want to get up here and say, hey, hospital's chipping in some money.
It's something to think about. We're
Absolutely.
providing the service for free, you know, it's helping them out, so
Sure,
conversation would be had.
absolutely.
Do you need a resolution? Do you need anything from us?
The only thing I think Judge will need is when the application's complete is just approval from the court to submit it to the state. And we anticipate having that ready probably by next court date.
Any questions or comments? And I appreciate the presentation, and
Yeah.
I do looking at,
Skip ahead a slide or two for me and we'll just, so one more.
there was one about partners. Is that?
See that? No budget.
So this first page of this is just basically kind of what I've covered, but it'll look a little bit more in details, in case you guys wanted to read it and see, maybe answer some questions we didn't get time to go over. But the second issue is the budget itself. So that's what I wanted to show you, kind of where we're at numbers wise.
And this would be part of the EMS, budget consideration when we have our budget.
And the city will pay, has the city agreed to pay half this? Well, I mean, I guess they would.
I will go to mayor, but anything like this,
Sure.
I mean, yeah. And this is not a, we had as you all are looking at that, we had a meeting last week with Stryker, and we had a presentation last year about that program and the ALS program, and it's essentially a 10-year agreement. And we've had that presentation again, but I invited our partners from the city just because I felt very strongly that, you're entering into a potential 10-year agreement, that they needed to be at the table on something like that. But something on this with one staff person and.
Yeah, and at the very bottom of the budget is a note about that ALS 360 project. If we do move forward with that, it would take a substantial amount out of this budget because the medical equipment is built into that long-term lease.
Okay.
Take out about $45,000 of the ask.
And we will share, did we talk about them doing a Zoom on the March workshop?
March 3rd.
So we have a plan to have Stryker do a Zoom to present that ALS overview at the March workshop.
Mm-hmm.
Do we have any other questions for Chris? All right. Yes, sir.
Can we identify last names?
Runyon? Are you
Chris
in
Runyon.
Uh-huh. Thank you. Appreciate your
Yes.
time.
But Jeff, you seem to think that some of the opioid
I,
money could be
I,
used on.
I think as we move forward that, you could identify a portion
Absolutely.
that I think the opioid settlement funds could be used for, because it's directly addressing issues resulted from the epidemic. So that's something I'll continue to look at too. And then before you sit down, I want to, always want to highlight positives.
Sure, yeah, me too.
Like, life's too short to be negative. Let's talk about positives.
Okay.
And the Godfather over there with that look on his face, like we sat down earlier this week and we were greatly concerned. Like, we've got 9 ambulances, but 3 of them were down after that accident, and 2 of them were out with transmissions.
Right.
Paul Miller Ford was saying, no transmissions, can't find it in North America, but you put the Godfather on it one day, and the Godfather found a couple transmissions.
I just made a couple of phones.
Well, I just wanted to say, we have people that work together and try to. It's a team approach, and I think we'll have transmissions in those 2 ambulances next week, possibly. So we've gone from. I was thinking we were going to have to ask you to buy a used ambulance from someplace in Pennsylvania, to we've got 2 transmissions that are going to be addressing a need. And so if that happens, then we're in decent shape then. So
We were a little stressed.
With that one that was in the wreck, does that affect the time
well,
that the ambulance will be in Stamping Ground or Sadie'ville?
I'm sorry.
With the one that was in the wreck and now is out of service, does that hurt the time that the ambulance will be stationed in Sadie'ville or?
No, it doesn't affect. So our concern was, we do have 9 trucks in our fleet. We run 6 on a full-time basis, and that's 4 to cover downtown, 1 in Sadie'ville, 1 in Stamping Ground. So we are down to 6. So we still have coverage. We just don't have a backup if something were to happen. Even a flat tire at this point,
we didn't want to be in that spot, and the ambulance that was in the accident broke an axle, and then also it did some damage to the box, and as much inside as outside, right?
Yeah, and we have a rough estimate on the exterior damage, but we have to have the equipment inspected now because it was involved in a wreck, so we don't know the total until we get that inspection done to make sure all the equipment's still operable.
So, thank you. Yes, sir, Rick.
While we're talking about it, what is the schedule for like Stamping Ground or Sadie'ville? There's not a buggy up there 5 days a week, 7 days a week. How's that work? Are they
There's a buggy there 7 days a week.
There is now?
24/7.
I didn't realize that. We're good.
Unless they're on a call.
Right,
Yeah.
right.
Yeah, they're out there 24/7.
So they don't have to leave and come to Georgetown if one gets called out of Georgetown?
Yeah, no, they do have to. If all the trucks go out downtown, then we will move one of our county trucks
Yeah.
down to cover, and we do that based on odd or even days. If it's an even day, we use Stamping Ground because it's our Station 2, and if it's an odd day, Sadie'ville will be the cover truck, and they'll come down and cover if all of these trucks go out on calls until
Thank
we
you.
get that new station.
Thank you all. With that said, going from one community paramedicine to another aspect of community health and public health, we appreciate you being here, Dr. Miller, to share, and I'll turn it over to you.
Okay. My last name's Miller. Okay. Yeah, you're welcome. So I thought, you've got data in front of you, but before we talk about that, I know there's a couple new members, and I thought it might be helpful to talk about why syringe exchange programs are in our wheelhouse at the local health department. And that's because the foundation of public health is we mitigate and identify all communicable diseases. But the reason that hepatitis C and HIV are different is because in 2015 there was an outbreak in Indiana.
Scott County, Indiana.
Yeah, we got a bunch of calls about that because they thought it was Scott County, Kentucky. But and that got our legislative body interested in what's going on in Kentucky. And so legislation was passed that syringe exchange programs must operate out of the local health department, and they must be approved by the county and the city to operate within the city that they are going to operate in. So it feels like so long ago, doesn't it? But we've been operating for a couple years, and so I think the last time I was here, I was going to come every 6 months, and then now 3 years have gone by, right, or 2.5. Something happened, and So anyway, you have data in front of you, and this is our annual report for 2022. But the reason behind a syringe exchange program is to identify hepatitis C and HIV in the community. And how do you do that, right? How do you find people with hepatitis C and HIV? And so syringe exchange programs are the way to do that. So we started operating in 2019, and this is our annual report for 2022. We have had a total visits of 661 in this year. Obviously, those are recurring, not individual visits. So we've had 86 new participants this year. That's an increase from last year. We have 148 total in our program for this year. We've referred out 71 services, and that's, you can look down in the white box, that's for vaccinations, STIs, treatment, family planning, hepatitis C care. So there's a variety of referral services that we offer. It's a little more geared toward females than males, 56% females, 44 male. We've given out 363 Narcan kits. We've had 64 reported overdose reversals with the Narcan that we've handed out. Our average age of a participant is 40. We have done lots of HIV and hepatitis C testing, 142 HIV tests and 44 hepatitis C. And the importance of that is obviously identifying, and so giving you a little data around hepatitis C. We're showing about a 43% positivity rate in hepatitis C. So Kentucky has some of the highest rates of hepatitis C. And we've also identified several cases of HIV in the community. So we have the syringe exchange program down there, but I want to talk about some of the things that's happened since 2019 that are really important, and we're seeing kind of the landscape change, which is what we were hoping. So I have a nurse practitioner that works part-time at the health department, and we got her trained in hepatitis C treatment, and so we're able to link positive patients up immediately with care and treatment, and we have just cleared 2 patients that had hepatitis C. And the reason that that's important, again, is reducing the burden on our hospital cost and our health care cost. It's about $100,000 to treat hepatitis C, and if it goes untreated, then it turns into endocarditis. And so that's really the reason that, obviously we are in this, is for disease mitigation. And so really proud of that. We have lots of partnerships. We do regular testing at Georgetown College. Anybody that invites us, we offer HIV and hepatitis C testing. And so it's really about awareness in the community. So we're seeing results. This is exactly what we thought we would see. We have an actual spot for people to come to the health department, but we also are doing lots of outreach in the community. So I'll stop there. And if you guys have any questions.
I had a question, not maybe for Dr. Miller, but maybe for Chris, and Crystal, you may know this too. Do you know for 2022 the total number of overdose deaths we had in Scott County?
I don't.
22, is it 10?
8.
I've got those in my office. I don't.
Well, I've got it on my email because you'd sent it to me. Just y'all keep talking and I'll find it.
Okay. So
That's down significantly.
And that was down compared to years in the past that we've had. I remember there was a large number at one time, and so that's kind of being reduced. And then I guess the Narcan, passed out the Narcan, has been reduced in the number of deaths we have as well.
So remember, y'all had to help me piece this together because the spreadsheet was 5 as of 9/7/22, and then there was, I think it was 4 more. I think that was total. But, just to give you a picture, in 21, there was 33 deaths in 21. And you back up to 20, you had 41 deaths. So the trend is good, but it's not, we can't stop.
And one of the things that we're working on is, what we want to do is, obviously we are in, our interest of it is disease control and mitigation, but what we want to do is no matter where someone enters the system, we want to be able to link them up. So we've just hired a community health worker that's going to build out a program for linking oftentimes they'll come into our syringe exchange program, and our staff those staff are trained to ask those questions and do harm reduction. But then we're going to have a community health worker that, if they're interested, if they need housing or they need a job or so really just trying to close in the gaps for anybody and meet them where they are.
So the thought process is that we've talked about collaboration between that staff person and the new homelessness intervention, affordable housing staff person. That type of collaboration, connecting the dots, is potential and hope. Rick?
Yeah, a lot of this is just the statistics and trying to take that and figure out what categories you can improve on or how,
Right.
which I think Chad may be correct. Like for 22, that's a significant, which is great, decrease in overdose deaths in our county. I think there's probably some other factors with 20 and 21 with the lockdowns, and people were, and I'm sure you're aware of all that. And I was just looking at the numbers, because one of the things that's always bothered me about this program, it still does, is there any way that you're tracking or even able to track? I just wonder if any of the participants in this program have overdosed and died. Is there any way to know that? It's just another statistic, but
Yeah.
because what's always bothered me is we're providing that half of that product to get that accomplished, unfortunately. But I don't know if you can track that or not.
Yeah, it's anonymous, so they come in and we give them an anonymous.
A number, yeah, I remember that, yeah.
That framework. And so I will tell you that lots of our participants that come in obviously have relationships with other participants, and so by word of mouth they may tell us, and we will know that, but not by
Any way to track
right,
it.
not by like linking up with Mark and kind of figuring that out, because it's anonymous.
Right.
Have you all seen a decrease in communicable diseases, Hep C, HIV, since you started this program? Like, I know you said this to identify, but
Yeah.
I would hope an end goal would also be to, any community medicine wants to decrease communicable diseases. Have you all seen any decrease at all?
Well, I think the problem with that is we don't have good baseline data. Like, we know there's high rates of hepatitis C, but that was one of the reasons why we have to have a program to bring people in, right? Because then we need to test you, because they're not just, people aren't just out here saying, hey, I want an HIV test, a hepatitis C test, right? I've never walked into my doctor's office and said that, and so this draws them in. But our baseline data, we don't have, that's not good data. But more importantly, I think it's very telling that we've just had this program for treating hepatitis C. We've already cleared 2 patients. And so what that means is, and what we're seeing is, they are now, because participants know other people with hepatitis C and know other people with HIV. And so they're telling other people that, hey, the health department has this treatment program where you can clear hepatitis C. We've just linked up a person with HIV that was out of care. And so that's another big win for us, is we're able to clear it, and then it's not spreading from that person. So, but to say, oh, this was our rate and now we've reduced it, we don't have good baseline data.
Any other questions?
Are the ages volunteered? Or how do you track that? You said the average age is 40.
Yeah.
But there's not an age limit, correct? I mean, that was one of the things I think when we first discussed it, because that's one of the reasons I didn't like it. Was like, I thought if a child that was 15 or 16 that wanted to go down and get needles should have permission from their parents, but we don't track the age, right?
So they come in and they complete an assessment, and that's where they mark the box on what their age is. So do we look at their license? No, we do not.
But if they're under 18, then there's no parent required to be involved.
Correct. And I will tell you, actually, we one of the things that we're doing from this is we've actually trained several schools on Narcan, because one of the high school principals called, and they were trying to figure out a couple of students that were using, and scared to death that they were going to overdose. And so we've trained some of the school staff on Narcan, because they are very much dealing with that right now.
Chad, you said, Corey, did you want to make a comment or ask a question?
Just one comment,
Come on up to.
Overdose deaths, that number is just really significant, because, so we track the EMS calls per overdose, and 2022 was the worst year yet at 197. So our numbers still going up to have the deaths go down that much. That's a huge, huge improvement. That's
Probably attributable to the Narcan, would you say?
Narcan, definitely, yeah. Getting it out more in the community. We have somebody from the health department go out with the overdose response team. We're giving them all kinds of stuff. And if they don't come to the door, we're mailing them resources about the syringe exchange program.
So they're getting that connectivity as well.
Right.
Is the Hep C treatment, is it for, like, that's not cheap at all? Like, is that a free service provided by the health department?
Through Medicaid.
What if they're
So
not
we
Medicaid?
link-
Or I guess they have to be,
Mhm.
they have to fall in the gap.
Or we link them up with a provider. So if they do have insurance, then we link them up with a provider, but we help them get signed up with Medicaid and go that route.
But back to the hepatitis C, so is that a curable? It is now. It wasn't when this program
Right,
started.
and we've just cleared, the other thing, we've just cleared two patients, and the other thing that we're finding is that there's research showing that it was an 8-week process, and now it's a 4-week. They haven't changed it yet, but they're showing that the disease will clear in as fast as 4 weeks, which what that means for us is oftentimes we have a hard time following these patients, right? So 8 weeks is a long time to keep somebody and keep coming into contact with them when they don't have transportation or all the barriers. And so that 4 weeks cuts it in half.
Any other questions? Dr. Miller, thank you as well, and appreciate your time. With that said, we will move down to Resolution 2303, which is an interlocal. It's a resolution in support of the interlocal for the farmers market.
That's correct.
And I'll ask Cam to read this. Now, if our guests don't want to stay for this section of the meeting, you're not going to hurt our feelings about this exciting farmers market resolution.
It's going to be great. Okay, Scott County Fiscal Court, Resolution Number 23-03. Resolution approving an interlocal agreement between the City of Georgetown, Scott County, and Georgetown Scott County Tourism for the construction, operation, and maintenance of a downtown pavilion, and authorizing the Judge Executive to sign the agreement and any relevant documents. Whereas, pursuant to the authority of the Interlocal Cooperation Act, KRS 65.210 to 65.300, the City of Georgetown, Kentucky, a municipal corporation hereinafter referred to as city, and Scott County, Kentucky, by and through its fiscal court, hereinafter referred to as county, and Georgetown Scott County Tourism, a local commission, hereinafter referred to as tourism, hereinafter collectively referred to as the parties, desired to enter into an interlocal agreement for the construction, operation, and maintenance of a downtown pavilion. And whereas City owns real property in Georgetown, Kentucky at 150 North Broadway, 164 North Broadway, 170 North Broadway, 112 East Washington Street, 114 East Washington Street, and 100 North Court Street, hereinafter collectively referred to as the property. And whereas County desires to construct a pavilion on the property to be used for public purposes, including but not limited to housing a seasonal farmers market and hosting local events, hereinafter referred to as the Downtown Pavilion, and City desires to support this effort by ensuring the structure and sharing future maintenance obligations. And whereas Tourism desires to manage rentals and scheduling for events at the Downtown Pavilion for the benefit and enjoyment of the citizens of the city and the county. And whereas the parties desire to enter into an agreement hereinafter referred to as the agreement regarding terms of the construction, operation, and maintenance of the Downtown Pavilion. Now, therefore, it is hereby resolved by the Scott County Fiscal Court that the interlocal agreement between the City of Georgetown, Scott County, and Georgetown Scott County Tourism for the construction, operation, and maintenance of a downtown pavilion, a copy of which is attached here too, is approved, and the Judge Executive is authorized to sign the agreement and all relevant documents. Done this 23rd day of February 2023.
Questions or comments? Would there be a motion to accept?
The maintenance on the building, who's going to be like in charge of that?
The maintenance?
The maintenance.
We will, the way the interlocal reads is, like we'll do the inspection, but the cost will be split. Like we'll stay up on it, and tourism will.
Like, is tourism going to be in charge of calling somebody for maintenance, or?
Well, if tourism was down there and noticed something, yes. And then, Jessica and the farmers market people, I'll be in communication with them. And if there's something that needs to be addressed, then it'll be on us. And I'll be calling, hey, JR.
Yeah. That's why I was wondering, JR, I'll be the one there fixing things.
But that, we will try to be efficient and try to address it and be a good steward of tax dollars and be smart with it. But if there was something that needed, if somebody hits a pole and we have to go down there and get an insurance, we'll go through that process. But we'll drive the boat. So we got a motion, second. Any other questions or comments? Ryan Pratt. All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Now we will move to number 13, Resolution 2304 TAP Grant. And I'm going to kind of ask Mike Woolham, who's here with us tonight, if he would step to the podium. And then Kim is also here with us. And I shared via email, Mike and his team, after, going through the review of the application and looking at the project, identified two concerns. One was the bridge over Cane Run, and the other was the road improvements on Lyle Road around the box tunnel that would include signalization of that possibly. And we have met twice now with KYTC since this point, trying to identify and make sure we were on the same page with them and their staff. And I actually Zoomed with Secretary Gray this, I guess it was last week. Time moves pretty fast. But I was on a Zoom meeting. I requested to meet with Secretary Gray and Kelly Baker. And I wanted Secretary Gray, because we talked about the previous TAP grant, to be aware of the situation. And Secretary Gray wanted me to communicate to you all. He intentionally asked me to communicate that he and the governor support this project. And, I asked him for advice and really just, was there any other funding mechanisms? And Kelly Baker mentioned that we could look at CMAQ funding, but the advice was go forward, if the court is supportive, go forward with a second TAP grant with Mike's numbers that are pretty comprehensive or are comprehensive. And I'll let Mike talk about your all's review and anything you'd like to share at this time.
Sure. Happy to do that. Thank you, Judge. When I was here last, we kind of gave an overview of the project and some of the needs and the challenges with the project, and so we went away from that meeting and did a more in-depth evaluation of the issues that need to be addressed as part of the project. And the meeting with District 7 was certainly very important for us to be able to understand where they stand on some of these same issues. And I think the good takeaway there is that they were very positive in trying to find a simple solution, where that can be made. And when you think about the tunnel and some sort of a signalization option for that, that's one of the complexities of this. And so we, with that feedback and then just a critical evaluation of the project as a whole over the entire quarter, we did a fairly comprehensive evaluation, and we actually have a lot of recent cost history from completed projects and recently bid projects that have a lot of the same characteristics that this project does. And so when we went through that evaluation, and I think Judge Covington included this in his email, there was a cost estimate. We updated the cost estimate, and if you go through all the math, the gist of it is that the total construction cost is estimated at over $4 million at this point. You all currently have, I think, $2 million in existing grant, and counting the match money that you've already allocated for that. There's additional budgeted items that need to be addressed for design right-of-way and utilities for for the project going forward in the amount of $802,000. And again, that's a budget at this point. There's not been any commitment of what those costs
And
might
could I
be.
stop you there? So part of my due diligence was I've met with Lee Carter and went out, did a site visit, and I looked at the Cane Run location where the bridge would go over. And originally, we were looking at a 300-foot bridge at a certain location. It was pretty wide for the floodway. And from that visit, they've actually looked at as well of maybe altering that crossing just a little bit, but it takes about 50 feet off of the.
Yeah, it's a decent chunk.
It's a 50-foot reduction on the bridge, which saves about $150,000. And one of the questions that was asked was, that bridge, will it be similar to what was been done in the Legacy Trail,
Yes.
other portions of the steel?
Yeah,
Corten
steel.
Corten steel.
And what it is, it's a pre-manufactured bridge structure, and then what they do is they bring it in, and this is where some of the cost complexity comes into bear, because they have to haul it in on a semi-trailer. They've got to back it in wherever the location would be to set it, and they have to have a crane to do that. And then once it's set, you actually pour a concrete deck. So there are a lot of components to that, and so it is a fairly sizable cost.
But the numbers that you have, and this new TAP grant, we'd be requesting additional federal funding in the amount of $2,318,400. Additional non-federal match required would be $579,600. So two considerations to think about is, number one, I have asked, and they have confirmed 100% in email, that if we elected that our flex funds from rural secondary road monies could be used over 2 years to offset that match number, which would take probably about $100,000 off each year. And then the other item that still need to do a little due diligence, but we believe that the donation, and Lee Carter has confirmed with me that if it's been done in the past, which it has, is that the right-of-way cost from the horse park could be donated, and that would be a number that would reduce that match ultimately. And then I have reached out to Lori with tourism. In 2013-14, tourism paid for the original feasibility study because they felt like this trail would impact tourism in Scott County, and I do too. I asked Lori if she would be willing to talk to the Tourism Commission about any possible capital considerations, and she's going to. I can't guarantee anything past that. And then I have spoken with Mayor Jenkins and Devin Golden and Stacy about the situation, and inquired with the city about this. And I need to sit down and show exact figures to Mayor Jenkins, so I can't really say anything past that. I have mentioned it, and I intend to sit down and show him. So what you've been presented with are that's the high dollars that we anticipate from a professional that does this all the time. And my hope is that match from us can be reduced. And then I also can say that the match can be spread over 2 budget cycles.
So one of the concerns I had was about Lyle Road, and if there was a need to put the turning lanes in on Lyle Road. Now, when we left that conversation, you were going to go meet with Kelly up at District 7.
And I have.
So what was their take on the need and possible monies if they want to provide it?
And Mike, you chime in, but they feel like to allow a semi to queue up is to be able to pull off the road and queue up. That's important, and that's included in. So if you're following me, instead of it can queue up and get completely off the road and allow somebody to pass through and then go through the tunnel. And that's part of this
That's
conversation. But as far as District 7 saying, hey, we'll give you 100,000 towards that or something like that, that's not been an option that's
So
been put
they
on.
basically said, use your flex funds to get this
Nope.
done.
Joe Pat Covington,
Okay.
trying to be creative, trying to see how we can reduce that cash, because the flex funds, and JR, you chime in too, because, the flex funds, what we have done since I've been judge is we've given that back to the state. It's almost like you give it back and you're going to get it back.
Well,
Yeah.
I don't disagree with what we've done with the flex funds. I was just want to see if the
They
state.
didn't suggest that.
Okay.
I suggested that.
Okay, so then they offer anything else as far as finances to help contribute that to this
No.
issue? Okay.
But, I still believe that what we're getting is a fantastic opportunity. I know the cost has changed, but I still believe that this is a fantastic community project, and I support it 1,000%.
As I was looking at these numbers today, Judge, and talking about finances, I was like, how can we offset this a little bit? So we're talking about putting in this bridge, 800,000 or whatever. Could we offer that up to, like, say, the community bank bridge on the Legacy Trail, or, get some sponsorship on this trail?
I mean,
Because it's a legacy trail. I mean, even family members that might want to recognize a family member. have
I would be
flowers
open
out
to,
there at a certain cost.
I would be open. That would be something that I'd have to talk to KYTC about, but I mean,
And probably
it's in Scott County, and
Naming the box instead of the box, something
yeah.
Buffalo Springs instead of Crossing or something.
No,
Throwing
being
something out
creative and looking at opportunities. Yeah, I don't think there's anything wrong with us pursuing that.
You probably have to see what the grant folks will allow
Yeah.
as well.
I have a question, just so I'm clear. The original grant was for 1.6 million with the 400 match.
Correct.
Are we saying that this is in addition to, or this, like, we would scrap that and this is a brand new?
So your total is 400 that we've committed, and the new second part would be 579. Now, take that 579, and we could, if we elect, to use flex funds to get that down to 379. So you're at 779. If I can get any commitment from tourism, if I can get any commitment from the right-of-way donation that could knock that down, and then anything from the city, then we would get that down. But we can use that out of 2 budget cycles. So like next year we could budget half of it, and the following year we could budget half of it.
In your conversation with Secretary Gray, I keep going back to the state for money, and I didn't know if they had. I know the governor has a slush fund, a discretionary fund that he could.
So at one time, discretionary monies amounted to $30 million. And I asked the question, and now discretionary funds allocated by the legislature is at $10 million.
So there's still a chance, but it's a lot less likely.
I asked, and he said those are really more on road safety issues that are kind of like pending out of.
I understand.
Yeah. Now the CMAQ is something else that we could look at, and we will pursue that. But the reason we have to make a decision on this is because the grant is due first week of March.
So two questions. If the court decided not to go forward, where does that leave us with?
I guess we give them back 1.6 million, and I think a lot of people in Scott County would be saying, "What the heck are they thinking about?"
I just want to pose that, and then the second question is, if we go forward and don't get the grant, are we back to?
If we don't go, and that's a fair question 1,000 times, then we have to go back to the drawing board. But I can't sit here and guarantee anything.
No.
But the secretary intentionally told me to share with you all that they support this project. And I can't say anything else.
But I'll say, just, following up on the discussion on the CMAQ funding, that application is going to open up later this year, and that there's less competition for that because you all are in a air attainment zone, and that's why it's congestion mitigation and air quality.
That's what CMAQ stands for. And so you have less competition, and the dollars available in that program are typically higher. So you would have maybe a more competitive opportunity to win that if for some reason we didn't win grant funding for this next TAP cycle that's currently out for consideration. But I just want everybody, and Rick, that's really a good question, and I should have addressed that, but I'd try to, I'm trying to be on the optimistic side, but that's a good question. But I feel very, like this would be a very competitive grant application. And then I want to just emphasize, I can't promise anything from tourism, can't promise anything from the city other than me sitting down and trying to make the case for some consideration of help on the match.
Judge, I'll make a motion because I want to give Secretary Gray and the governor an opportunity to get in there and go fight for us. And I mean that.
No, I'll second that motion.
And because we're kind of stuck, and we've got to try to go forward. We're kind of stuck.
So Stacy's reminded me that Cam has to read the resolution, then you can motion and second
Thank
it.
you, Stacy.
Thank you, Stacy.
Okay, so here's the resolution. Scott County Fiscal Court Resolution 23-04. A resolution of Scott County, Kentucky. 1, authorizing the judge executive to apply for additional Transportation Alternatives Program, or TAP, grant funding, seeking federal TAP grant funding in the amount of $2,318,400, with a commitment of matched funds from Scott County in the amount of $579,600 on the Lyle Road portion of the Legacy Trail Extension Section 1, Phase 1, or project. And 2, authorizing the judge executive to request the use of rural secondary flex funds towards Scott County's matched funds on the Lyle Road portion of the project. Whereas Federal Aid Highway Program state administered funding was previously awarded for the project, and whereas the project has incurred projected additional cost due to the needed construction of a pedestrian bridge and installation of turn lanes in the area of Lyle Road, and whereas the project will positively impact Scott County by providing recreational opportunities and enhancing the quality of life of the citizens, now therefore be it resolved this 23rd day of February 2023 by Scott County, Kentucky, the judge executive is hereby authorized to apply for the above-mentioned funding and to request the use of the above-mentioned funds and to sign and execute any necessary documents relating to the project and to act as the authorized correspondent for said project. Done this 23rd day of February 2023 on motion made by so-and-so and seconded by so-and-so. Rick?
So I'll make that motion. I want to make one more comment. Because what I was thinking about when I said to give Secretary Gray and Governor Bashir an opportunity to go to bat with us, I was thinking back about Weisenberger Mill Bridge. And Secretary Gray and Governor Bashir went to bat with us because that thing lingered for years. 2 or 3 years or something.
More than that.
Right. I mean, it was a lengthy. I think JR will remember. It was a big time frame, but they went to bat and got it done. So that's what I meant. I think if they say they'll go to bat, they'll go to bat.
No, and I'm confident of that. 100%. But back to your comment about if we didn't get it and we only had that $2 million. One of the conversations we had was, well, we could extend the trail, but we'd have to probably end it at Lyle Road, and it would be a road to nowhere, so to speak. You know what I'm saying? But what this does for us is if we could get this tap, then we can do the whole project and do it the way it was intended. So we've got a motion. We have a second. Any other questions? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Thank you, Mike.
Thank you
And
all.
we'll get a signed copy, and then you're putting do you need letters of support?
Well, there were a lot of really good letters.
Can we use those again?
That's what we're going to do.
Okay.
There were a number of them.
Okay.
And Kimberly, I don't know if you were the doer on that, but that was a really good job of pulling all that together.
And you're taking updated information to create this new.
That's correct.
But what we did originally was we took the feasibility study, we tried to move those data points, those numbers to when we submitted it, but it was just short in those two areas. And one was the Lyle Road, which is a big chunk, and then the bridge had to be a little longer on that floodway. It is what it is.
Judge, I just want to say, I appreciate you, and I keep pushing because I want to keep looking for other monies, but I really appreciate you vetting this process to try to maximize everything, because I'm going to keep pushing you.
Well, but I feel a duty to you all. Like, I want to be able to answer questions before you ask me in court.
All you got to do is ask me. And I'll tell you what I want.
But I knew. Have you asked anybody for more money? Is there any other options? And Mike and I talked about that, so I appreciate it. So, Mike, thank you so much, and very much. Next, planning and zoning appointment. We have received a letter from our colleagues, Mayor Keith Murphy, current Representative David Vest represents the Stamping Ground area on the Planning and Zoning Commission, and feels very fortunate to have Mr. Vest as part of the Planning and Zoning Committee, and he is eligible for a reappointment, and they are recommending that. And I would say that's a great suggestion. Would you like to comment, Rob? Because
I talked to Mr. Vest, and he was tickled that we was asking him to serve another term, because he really enjoys the job, and he would like to stay on, so he was very happy about it.
No.
I'd make a motion.
Motion,
I'll
second from Mr. Jones. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Next, 15 is ordinance 2301, first reading, and it's a fund, and this one is to address the opioid settlement monies? Or is it this one, the ABC?
It's on his sheet.
This one's the ABC.
All right.
Yeah.
Do you have a comment there?
I'm just standing here in case there is one.
Just saying.
It's a long
They're
walk.
actually budget amendments.
Okay,
You may-
go ahead.
All right, Scott County Fiscal Court, ordinance 2301, an ordinance relating to the annual budget and amendment thereof. Whereas Scott County, Kentucky has realized unbudgeted receipts, be it ordained by Scott County of the Commonwealth of Kentucky. Section 1, current fiscal year 2022 to 2023. The budget for the current fiscal year is amended to increase/decrease the receipts from the following funds to include unbudgeted receipts from the following funds: the general fund account 014402, alcoholic beverage license amount $4,766, a general fund account 014402-001, alcoholic beverage regulatory fee of 5%, amount is $8,162.96. General fund account 014909, cash transfer out to other funds is in the amount of $12,928.96. The ABC fund account 834910, ABC cash transfers in from other funds, $12,928.96. Total amended revenues is $12,928.96. B, appropriations funds, the ABC fund account 835050-566, alcoholic beverage control, I guess that's reimbursement to general fund, is that right? Abbreviated. Amount is $12,928.96. Total amended expenditures of $12,928.96. Section 2, the amounts adjusting the receipt and expenditure accounts in Section 1 are for governmental purposes. Approved by the Scott County Fiscal Court this 23rd day of February 2023.
Any comments? Any questions?
Why are we doing, I don't understand.
We have to do that in order to expend the funds. We can receive the funds into the bank account, but unless there is an established ABC fund, you can't spend the
So
funds.
that ordinance just, okay,
Establishes the
Cleans it
fund.
up.
gotcha.
But then these funds have to be spent on,
ABC, yeah, only ABC administration.
You know, in the
fund-
budget, general,
funds.
road, jail,
Right.
Jail,
LGA, now
But-
you'll have
Sheriff's
ABC,
Department.
settlement.
Well, the sheriff's department, the administrator of the fund, and any miscellaneous paper, whatever, anything that administers the ABC. And right now, we can't reimburse the general fund for those purposes because we're locked. We didn't have the fund open for
we went through the
expenditures.
same thing in Stampground too, so we had to do the same thing.
That cleared up as
Yes, sir.
good as mud.
Sounds like government work.
Motion, was that a second I saw from Mr.
We got
Jones?
excited. There's a second.
Any other questions? All those in favor, please say aye. Aye. Any opposed? Motion passes. The next, same situation, very
Exact same
similar.
situation, except with opioid.
And this is
opioid
with the
settlement
opioid
funds.
settlement funds.
And this will be, over the next however many years.
Bigger
The-
number too.
A little
Like,
bit.
I think we are scheduled to receive settlement funds over 13 years.
Okay. This is ordinance 2302, an ordinance relating to the annual budget and amendment thereof. Whereas Scott County, Kentucky has realized unbudgeted receipts, be it ordained by Scott County of the Commonwealth of Kentucky. Section 1, current fiscal year 2022-2023. The budget for the current fiscal year is amended to increase/decrease the receipts from the following funds to include unbudgeted receipts from A, revenues, funds, general account 014760, court settlements in the amount of $292,542.89. Fund general account 014909. Description is cash transfer out to other funds in the amount of $292,542.89. Fund opioid settlement account 854910. Transfers from other funds amount $292,542.89. Total amended revenues $292,542.89. B, appropriations opioid settlement fund account 859300. Description, transfers of appropriations to other funds amount $292,542.89. Total amended expenditures $292,542.89. Section 2, the amounts adjusting the receipt and expenditure accounts in Section 1 are for governmental purposes. Approved by the Scott County Fiscal Court this 23rd day of February 2023.
Questions or comments? Would there be a motion? Motion from Mr. Pratt, second from Mr. Hostetler. Any other questions or comments? All those in favor, please say aye. Aye. Any opposed? Motion passes. Next, I would like your consideration and approval possibly for to put a bid out and advertise a bid for HVAC improvements at the Judicial Center, the current Judicial Center on Hamilton Street. We received, essentially the scope of work and such from Shrout Tate and Wilson. Shared that with you all. There will be a pre-bid meeting that Shrout Tate and Wilson will run to try to answer questions, and then we'll receive bids. I think the date you had was the 6th or April 6th at 2 o'clock. So questions or comments? And just for everybody's, the AOC will pay 50% of this cost in the Scott Fiscal Court. We have the right to reject any and all bids. Once we review it and get feedback, then we'll go from there. But no matter what, that building down there, the HVAC is not. It's not working, and it needs renovation.
One of the things that we had mentioned, I think, was some group that controls it from outside.
That won't be the case anymore.
Okay, that's the question I had.
Yeah. Would there be a motion to accept? Motion. Is that a second from Mr. Corman? Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Any new business?
Is there do you have a kind of a status update on the new judicial?
Yes, sir. I don't know if it was yesterday or 2 days ago, but I guess it was yesterday. I signed the deed for closing the last parcel. So the Project Development Board now has completed procurement of all the parcels, and the demo team is on site. They had a big track hoe down there, and they started right there behind the garage, taking out trees and brush, and they're mobilized, and there'll be a fence that goes up next week, and then they'll start working on buildings.
You got any kind of a target dates?
Target
yet?
date for putting the bid out has been discussed as October.
Wow. Still a little while.
So it's
So we're 2 or 3 years away from.
it's a couple 24 months. What would be great is if they could do a bid package for excavation and foundation earlier, and get us up out of the mud and dirt before winter, and then put out the second bid for the rest of the building. That's been a topic if we could navigate that, but that's just been a sidebar conversation. So I hope that doesn't find its way to the newspaper. But like we want to get this done. We need to, and if we could navigate that you've been out in the mud for the last month at your last project, haven't you?
6 months.
6 months. So it's timing. Any other new business? I have any other.
Hey, Judge, I wanted to share.
Just
Oh, Jared Holland.
yes, I want to talk a little trash.
So.
Stacy, I'll go quick, okay? I don't want you mad at me.
So Jared's going to talk about this. This was shared on social media. Go ahead, Jared. Sorry.
Okay, in the community working together, this is some good data. And I know Judge Covington likes good data and measurables and looking for improvements. The first topic,
James.
I'd like to thank the Godfather, his respective crew, working with Swartz and the city of Georgetown, Robert Bruin. 3,700 bags of trash were picked up this year, and that's just a lot. And we used a state litter abatement grant for that. Also using a waste tire grant from the state. 800 tires were picked up in Scott County. And then also, too, thanks to Toyota, 84,000 pounds of hazardous and electronic waste were disposed of properly. And this next one is a good one. 1,300 tons of recycles through the Scott County citizens and our respective waste haulers and the new Rumpke transfer station. The 1,300 tons of recycles is doubled our 2021 total. So we definitely see numbers going in the right direction. Of course, we'd like to maybe see a lot less litter, but thankfully through JR and Swartz and Robert Bruin, they're doing a good job of keeping Scott County clean. So that's greatly appreciated. So if anybody's got any questions, I'll be glad to answer them. This is a state requirement. It's a yearly report, and then they forward on to the federal government also.
So that federal report that was submitted earlier this week, that we just wanted to highlight some of the numbers. And if you don't tell people the story, they don't know what good things are going on. And the Swartz and JR and Mr. Bruin, the collaboration there is huge. Trying to keep, but it never stops. But I appreciate JR's work and Robert and all that collaboration with the city, and then the recycling piece with Rumpke out there is very helpful, and then a lot, every citizen, I think, has access to curbside recycling. And Jared, I appreciate you putting all this together.
Yeah, and I'd also like to always thank Toyota because, I'm thankful that you all budget for this event, but they do most of the heavy lifting with that event. So I'm very thankful to Toyota doing this hazardous waste event annually, or every year. So I'm very thankful for that.
No, and yeah, no question, thankful for our partner in Toyota. Any questions for Jared? If not, then would there be a motion?
1 second, Judge. I got,
sorry.
I wanted to share an invitation with the public and with the members of the court. I think I put a flyer on everybody's seat. I'm a board member of the Not Alone Pregnancy Center, which is headquartered right across the street from the courthouse. And we're a pro-life group, and our biggest fundraiser is our Sanctity of Human Life banquet. So it's coming up in 2 weeks from tomorrow. So if you're interested, you can contact me, or if you've got, I'll give you a copy of this invitation. There's Eventbrite that's handling tickets, or you can get a hold of me, or there's a phone number to our office across the street. You can get them that way, but just want to invite everybody. And,
thank you very much.
Yep.
Very good cause. Would there be a motion to go into executive session under KRS 61810(1C), pending litigation? Motion for Mr. Jones, second for Mr. Corman. All those in favor, please say aye. Aye. Any opposed? We'll go into closed session. There's a second for Mr. Jones. Any other comments? All those in favor, please say aye. Any opposed? None. Let the record reflect that no action was taken in closed session. Is there a motion to adjourn?
Yeah, I heard one.
And there's a second there. All those in favor, please say aye. Any opposed? We are adjourned. Thank you all.
You guys took a long time.